My name is Erin Hayward. I'm a family doctor at the University of Iowa. I'm a member of the Congolese Health Partnership, and I'm one of the physicians at the International Family Medicine Clinic at the Scott Boulevard Clinic for the University of Iowa. And I am here with my esteemed colleague on the Congolese Health Partnership, Bijou. Bijou, could you introduce yourself?
Yes, thank you, Erin. Hi, my name is Bijou Maliabo, and I'm also a member of the Congolese Health Partnership, and I'm also a leader in the community. Thank you.
So Bijou and I are here to talk this evening about the COVID-19 vaccine and a lot of questions that have come up about it. I volunteered to share my experience with the Congolese Health Partnership because I was privileged to be one of the first physicians in the state of Iowa, among the first, to receive my COVID-19 vaccine back in December of 2021 because I care for patients in the hospital, and along with many other physicians and nurses and hospital custodial staff and all the people who are involved in caring for those folks. We've been getting our vaccines for a long time now, so happy to share all that with you. Here is I have my card for my show and tell from my experience. You can't see it too well being vaccinated. I received the Pfizer vaccine, the first dose in December, and the second dose 3 weeks later. The Pfizer vaccine was my vaccine that was assigned to me. My husband, who is also a physician, received the Moderna vaccine. And those of us who got the earliest sets of vaccines were pretty much split evenly between receiving the Pfizer vaccine, 1 dose, and the second dose 3 weeks later, and the Moderna vaccine, which is 2 doses as well, the first dose and then the second dose 4 weeks later. And since we started vaccinating in Iowa and around the country, we have a new vaccine, which is the Johnson & Johnson vaccine, which only requires a single dose. So there have been a lot of questions about these vaccines in the Congolese Health Partnership. So we are going to create this video in English, but also in French and in Swahili and Lingala. If any of those languages are better for you, we invite you to come check out our other videos. So Bijou is going to ask some of the questions that we've heard asked around the community, and I'm going to answer them as from my perspective as a physician caring for folks that have COVID-19, that don't have COVID-19, and we don't want to get COVID-19. So Bijou, take it away.
Yeah, thank you, Erin. Thank you so much for being vaccinated. And it's very nice to hear that you were one of the first people that got to experience that. I'll be asking you some questions that the community is asking, and maybe we can receive some answers. Here we go. Who should receive the COVID-19 vaccine?
As a physician, I want all of my adult patients to receive the COVID vaccine, not just my patients, the entire community, everyone over the age of 16. The only exception is those people who've had a severe reaction to the vaccine or one of its ingredients in the past. And so I'm speaking to everyone here. If you're not sure if you should get the COVID-19 vaccine, you should have a conversation with your healthcare provider. Chances are the answer will be yes, you should receive a COVID vaccine. So basically everyone.
Thank you. If I already had COVID-19, do I need the vaccine?
Even if you tested positive for COVID in the past year, it is actually possible to be reinfected with the virus and potentially have a severe illness. So the evidence also suggests that immunity from the illness does not last as long as immunity from a 2 vaccine series or a complete vaccine series, even if you had COVID. So yes, you should get the vaccine even if you've had COVID-19. You may not get the vaccine if you currently have COVID. If you currently have COVID, we recommend that you wait until after you have recovered to receive the vaccine, after you're feeling well again.
Okay, thank you. Can kids get vaccinated?
Maybe soon, but not yet. For the moment, the vaccine is only being offered to children over the age of 16, but children are currently enrolled in studies to receive the vaccine in the future. So we are pretty sure that COVID-19 vaccines will be safe for children and will be effective for children, but we don't yet have that data. We will next learn about children from ages 12 to 15 and then learn about younger children later. But currently only adults over the age of 16.
Okay, good information. Thank you. I heard that the technology used to make the Moderna and the Pfizer COVID-19 vaccines is new and has never been used before. Is it safe?
It is true. It is very new and it's so very interesting and cool. So the Pfizer and the Moderna vaccines they're called mRNA vaccines, which is a small molecule that acts as a messenger, and we all have mRNA within our cells. So it's a small molecule that breaks down very quickly in the body. The new vaccines train the body to make its own immunity to what the mRNA message is given within the cell. It's a little bit complicated, but if you understand the biology, it actually is very simple. It is a new technique. It's very effective. These vaccines are over 95% effective in preventing symptoms of COVID-19, and they were first tested on healthcare professionals who also kind of understand the science, and we're very happy with the new technology. There is a lot of great information out there if you want to do more reading about it and get into the science of it. The Johnson & Johnson vaccine is based on some older technology, which is also very effective.
I know you talked about all three types of vaccines. So how do we know all the vaccines are safe?
Good question. There's a lot that goes into a vaccine trial, even before it is tested on humans. But the first phase of human trials actually included 40,000 people who were given the COVID-19 vaccines, the initial ones, before they were even used in the general population. So they started with 40,000 people in the trials, and then they've been used in U.S. healthcare workers initially. So the first several 100,000 people to be vaccinated were healthcare workers, and we're finding that there have been very few negative reactions to those vaccines. And now we are several months into it, and we're not learning too much new about bad things that can happen with the vaccines. Many people commented that the vaccines were developed very quickly and wonder if the safety precautions were skipped in the development. But these vaccines have undergone the same safety testing as all other vaccines. It's just that due to the urgency of the COVID pandemic, the manufacturers got a lot of money and a lot of interest and a lot of ability to take all these steps relatively quickly. It's true that the Johnson & Johnson vaccine was recently temporarily suspended from use during the month of April of 2021. So about 6.8 million doses were administered in the United States. And of those 6.8 million people, 6 individuals developed blood clots. All 6 of those cases occurred in women from the ages of 18 to 48, within 6 to 13 days of being vaccinated. So all the vaccinations with the Johnson & Johnson vaccine were suspended, and the safety data was thoroughly reviewed by the CDC and the FDA. And after that thorough review, the CDC and the FDA decided it is safe to continue using the Johnson & Johnson vaccine because so few people were affected by that rare complication. However, young women or women under 50 should be aware that there is a rare risk of a unique kind of blood clot and low platelets that can occur after vaccination. That safety issue has not been seen with Moderna or Pfizer.
Okay, thank you. What are the side effects?
You might experience side effects from these vaccines. Some vaccines rarely give side effects, and some vaccines commonly give side effects. And the COVID-19 vaccines commonly give side effects. So as a doctor, I'm often just warning my patients ahead of time before they get the vaccine that they are very likely to experience a little bit of fever, a little bit of chills, some muscle aches, and maybe a mild headache. A lot of people have fatigue a day or two after the shots. We like to encourage people by saying that these symptoms are actually kind of a good thing. It means that your immune system is reacting to the virus and learning how to protect your body from COVID-19. but many people have no side effects at all. You might have also heard that some people have allergic reactions to the vaccines. That is extremely rare. In the early data, only about 11 in 1 million people reacted to the vaccine. And of those who did, they all received medical treatment for something called anaphylaxis, which is a treatable reaction. And because there are those rare allergic reactions to the vaccines, that's the reason that we ask everybody to stay around in their vaccine site for 15 minutes after they get the vaccine. That extra wait is for your safety, to make sure that you don't have an allergic reaction to the vaccines. And if you were to be one of those rare people who had the allergic reaction, we would be ready to treat you there.
Can I get COVID-19 or any other illness from the vaccine?
Good question. The COVID-19 vaccines do not contain live COVID-19 virus or live coronavirus. So it is not possible to get COVID-19 from the vaccine. The Pfizer and the Moderna vaccines, and in some part, the Johnson & Johnson vaccine as well, they only contain the instructions that tell your body how to make one small, incomplete part of the virus to teach your immune system to respond to that recognizable part of the virus and attack it. So this is why you will actually experience the side effects from the vaccine, or some people do, which is your immune system learning how to protect you from the real coronavirus, which we hope you'll never have to see. There are some news stories that say that people have died after receiving their COVID-19 vaccine. In general, these have been very elderly people who have died from other medical conditions, not because they have died of the vaccine. They have died in proximity to the vaccine. So we have seen those news stories out there, but we haven't been able to say that the COVID-19 vaccine has really caused those deaths.
Is COVID-19 vaccine safe for people of color or minorities?
All three of the COVID-19 vaccines that are available here in the United States have had people of every race included in their vaccine trials. So people who are Black, Hispanic, Asian, American Indians, they've all been part of the vaccine trials. And the vaccine has been found to be safe across all racial and ethnic groups.
Thank you. Can the COVID-19 vaccine affect my fertility?
The COVID-19 vaccine does not affect your fertility or your ability to have a baby. Actually, during one of the big vaccine trials, there were 23 patients who received the vaccine and then went on to become pregnant during the trial. So it's important to keep in mind, actually, that pregnant women can become very sick with COVID-19 if they are exposed to it. And it's much more dangerous to catch COVID-19 if you are pregnant, and it can potentially have serious health impacts for mom and baby. So if you're thinking about becoming pregnant, it is definitely advised to get the COVID-19 vaccine so that you'll be protected against COVID.
Is it safe for me to get the vaccine if I'm pregnant or if I'm breastfeeding?
We don't have the final answer on that yet, but based on how we know the vaccines work, those who study the vaccine believe that they are very likely to be safe in pregnancy, and they're unlikely to pose a risk for people who are pregnant. We don't have a ton of data on that yet, but those trials are still ongoing. So this is a good opportunity for pregnant women to talk with their doctors to help make that decision. Most pregnant women have the opportunity to see a healthcare provider, and that is a good conversation to have. There are clinical trials underway right now to see how to learn more about the safety and efficacy of the COVID-19 vaccines in pregnant people. There were animal studies done in pregnant animals while we were learning more about these vaccines, and it was shown to be safe in animals in pregnancy. So there are some pregnant women who are choosing to receive the vaccines along with their physicians. I know many pregnant physicians who have received the vaccine. So this is ongoing and a good opportunity to have a discussion with your individual healthcare provider in your pregnancy.
Okay, thank you. If I get the vaccine, do I still need to wear the mask?
The CDC has said that it is okay for fully vaccinated people to gather without masks if it's more than 2 weeks after the second dose of the vaccine. However, even if you're fully vaccinated, the CDC still recommends wearing a mask if you're indoors or if you're outdoors in a crowded place. So if you're unvaccinated, if you are vaccinated but you wish to visit an unvaccinated person, you should still probably wear a mask if you're indoors. Try to stay at least 6 feet apart, as we've been saying for a while. Once the majority of the population has been vaccinated, all of these needs will be reassessed if we see the rate of COVID-19 continuing to decline.
Okay, thank you. How do I know if I'm eligible to get vaccinated?
So currently, the COVID vaccines are available for individuals over the age of 16, and I think we have some data that we can show you on that now. I have made great use of the state of Iowa website that you can find online very easily just by Googling "vaccinate Iowa." You'll find some great opportunities there. And then here is a list of all of the websites that you can use to find a vaccine opportunity nearby your house.
Thank you. So where can I receive the vaccine in Johnson County?
So there are several places offering the vaccine in Johnson County. You can receive it at a local hospital. Mercy, Iowa City has many opportunities. The University of Iowa Hospitals and Clinics has many opportunities. Many of the pharmacies are offering the vaccine. For some of my patients for whom internet use is not easy, I have signed them up to get vaccine slots at their local pharmacy using the Vaccinate Iowa website. It takes probably 3 minutes to get online and find a site. So if you are someone who is good at using the internet, but you know people who are not good at using the internet, you can help them get signed up too, because online is really the easiest way to do this. So Vaccinate Iowa is a great place to start. And then all of those websites we just showed you a moment ago. Many people are receiving vaccines in their places of employment as well. If your employer has information about how to get vaccinated, that's a great and easy way and convenient way to do it. So this is something for all adults over the age of 16 to plan for in their lives.
Okay. Yeah, I have one more question. So there's some people that have doubt. I know we have so many places that have the vaccine available for people to go get vaccinated, but some people have doubt of going to like Walgreens or Hy-Vee. They'll rather go to the hospital. Is the vaccine given to people the same at the university than other places?
Yeah, it is. I'm so glad you asked that. All of the vaccine sites in the United States right now are giving the same 3 types of vaccine. And I'll mention it again. The Pfizer and the Moderna vaccines each are 2 doses. So if you receive one of those doses, you will make an appointment to come back to receive the second dose of that vaccine. The Johnson & Johnson vaccine is a single dose. So you receive that, and then we consider you to be fully vaccinated just 2 weeks after you receive that single dose of the Johnson & Johnson vaccine. We consider people to be fully vaccinated 2 weeks after their second dose of the Pfizer or the Moderna vaccine. But the same 3 vaccines are being offered in all places that are offering vaccines.
Thank you. Thank you so much, Erin. Thank you for all this information. And I'm pretty sure a lot of people will be able to get answers from this. And I know people have more questions and we'll be back, but do you have anything else to say in regard to the vaccine or you being vaccinated and everything in the process?
Just go get one. Go get one. And don't hesitate to reach out for help. You can call any of the numbers you've seen. You can call the hospital, the University of Iowa Hospitals and Clinics where I work if you would feel most comfortable getting one there. But in order to, it's probably more convenient and easier for most people to get them at their local pharmacy. So if anyone has any questions, please just reach out to the Congolese Health Partnership. Reach out to your family physician or your healthcare provider. We would love to talk you through the process and answer any additional questions that you have.